In certain communities in your district, coverage rates have been dropping. You have confirmed that outreach sessions are being conducted regularly and that no vaccine shortages have been reported. Based on conversations with health workers, you suspect that there may be other barriers preventing caregivers from seeking immunization. There can be several reasons for low coverage rates, but it is often related to how we engage and communicate with communities. How would you explore this problem and determine whether it can be addressed using communication and community engagement? There are different strategies to improve communication around immunization, but this video focuses on identifying when those strategies are needed. To determine whether communication can address immunization problems, you will need to investigate the root cause of the problem, determine the main barrier to immunization, and consider whether communication strategies could help address the problem. First, you would investigate the root cause of the immunization problem. When faced with an immunization problem, you will need to ask why it is occurring. Keep asking why until you find the root cause. Make sure to gather input from many different perspectives, including health workers, community members, and caregivers. Start with health workers in communities with low coverage rates. Ask, why do you think rates are low? What problems have you observed? Hold community discussions with caregivers, village leaders, and religious leaders. Community meetings should be held at least once a year, especially in low coverage or hard to reach areas. Ask, what do you think about immunization services? Are sessions easy to get to? Why or why not? Why do kids need to be immunized? How do you know when outreach sessions are taking place? Speak one-on-one with caregivers and listen closely. Conduct household surveys, especially in households with unvaccinated or under-vaccinated children. Ask questions like, why do you not go to immunization sessions? What do you think can be done to improve our services? Remember, keep asking why to get to the root cause of a problem. For example, say you learn from health workers that caregivers who visit the clinic are refusing vaccination. Through community meetings and household surveys, you learn there are rumors that vaccines cause sterilization. By asking why, you have determined a root cause of the problem. Next, determine what is the main barrier to immunization. The main barriers to immunization usually fall into 4 categories. Immunization system gaps, such as infrequent or inconvenient outreach sessions. Communication and information gaps, such as health workers with poor interpersonal skills. Parental knowledge, attitudes, and beliefs, such as a lack of accurate information about vaccines. And finally, family, economic, or cultural characteristics, such as when women are discouraged from traveling alone to bring children to sessions. The rumors about vaccines you identified relate to parental attitudes and beliefs. Then consider which communication strategies could help address the problem. Remember, the 3 main types of communication activities are advocacy, social mobilization, and communication for social and behavioral change. Consider whether any or all of these communication strategies could help. Ask yourself, could advocacy address this problem? Would it help to get support or resources from leaders or decision makers? For example, you could work with community leaders to address rumors about sterilization. Could social mobilization address the problem? Would it help to involve community groups to promote and participate in immunization? To address rumors, you could arrange a meeting with groups who are resistant to vaccination where they can share their concerns and receive accurate information. Could communication for social and behavioral change address the problem? To dispel the rumors, you might train health workers and community volunteers on their communication skills so that they can visit and motivate caregivers who are resistant to immunization. You can see that the root cause of this problem can be addressed through communication. Once you have determined that the root cause can be addressed by communication, you can begin to develop specific strategies to address the problems. Now you know how to determine whether immunization problems can be addressed through communication.